Today we're here interviewing Suliman Alshuaibi, who is health attaché for the Saudi Arabian Embassy in the U.S. and Canada. Can you tell us a little bit about yourself and what you do?
Yeah, my name is Suliman Alshuaibi. I'm the health attaché for the Saudi Arabian Embassy in USA and Canada. I'm in charge about all the patients that who coming to United States and Canada for medical treatment. Also, we in charge about recruitment some of the physician and the technician that we need to work in Saudi Arabia for a permanent work. And sometimes we send to Saudi Arabia some visiting doctor that would do a kind of treatment or a kind of surgery or something like that to help some of the physician there to do some of the surgery that it can done in Saudi Arabia, but it needs somebody that who more expert and he has a large experience in doing this kind of surgery. Going back to the patient in Saudi Arabia, all the patient, the Saudi patient in Saudi Arabia, the government, they treat them free of charge. I mean, there is no charge for the Saudi patient to be treated in Saudi Arabia. If I'm going to talk about myself, I graduated from United States, from Oklahoma University, in accounting and also in accounting information system. I did a lot of courses in the state. Besides that, I've been working with several American companies before I transfer my work to the Ministry of Health.
How many patients do you help coordinate care for?
The number of the patient, it varies from time to time. It's increased during the summertime because it's a holiday in Saudi Arabia, and most of the people, they need to come to the state for treatment during the summertime. But in average, we have about 250 to 300 patients in the state, been treated in different hospitals in the state.
And how about Canada?
We don't have that much of patient in Canada because most of the hospital in Canada is a governmental hospital, and most of the people, they prefer to have their treatment in the United States.
How do you determine which hospital that you might actually coordinate care for?
The system that it's work before the patient come to the state, they send us a medical report about the patient, and we study the report and we decide which hospital that we can send to be treated, and then we send the report to the hospital, and when we get the acceptance from the hospital, we send the acceptance to the highly medical authority in Saudi Arabia, who decide to or to agree to send the patient to the state, because at the first time they need to know if this kind of patient, he has a treatment different than when we have in Saudi Arabia or not.
And are there certain types of procedures that seem to be the more common procedures that patients would come to the U.S. for?
Most of our patients, they come to the state, they are cancer patient or a patient they need to have a transplant, either a liver transplant or lung or small bowel or some of the cosmetics surgery that after burning or some severe accident, something like that. This is most of our patients, they come for treatment here.
How long typically do the patients come?
How
long, how much time do they come to the United States for treatment?
The average for the patient to be in the state is 3 months, but it can be extended according to the situation of the patient. And if we know that this patient, there is a progress in his treatment, we will ask the highly medical committee to extend his treatment for another 3 months.
Typically, do they come alone or do they bring a...
No, the patient, he has to come with one of his companion, either if the husband the wife comes with him, or if it's the wife is the patient, the husband, sometimes the children, sometimes it depends about the patient, but it has to be at least one companion with the patient come.
I know that Saudi Arabia is investing in its healthcare,
Yeah.
so I'd like to be able to hear how they're investing in healthcare and hospital infrastructure.
It doesn't mean that when we send the patient to the state that we don't have treatment. No, we do have all the treatment. But sometimes we are looking for something that different than we have, something sophisticated than we have in Saudi Arabia. But if we want to go back to the investment, no, yes, the government, they're investing a lot of money in the healthcare. If I'm gonna count the budget, how much the budget for Saudi Arabia investing just for the Ministry of Health, it's about, the budget for the Ministry of Health is about 35 billion Saudi riyal, which is almost about 10 billion US dollars. This is the budget just for the Ministry of Health. We have the National Guard, they have their hospitals. We have also the Ministry of Defense, they have their hospitals. And we have the university. Most of the university, we have about 26 university, and most of these university, they have their hospital. Besides that, the security armed forces, they have their hospital. Recently, the king issued an order for establishing about 4 medical city, which is a huge city. It's almost similar to the Houston Medical Center. Most of these city, it has about between 2,000 to 300 bed. This is going to be ready for ready for operation within 2 years from now.
Did you find value in today's Minister Summit that you participated in? Or what are your thoughts for other governments that might be interested in this topic?
Right now, we are working with some of the university for training some of the physicians that who graduate from Saudi Arabia to have some training here in the state, and this is going to help us to have more facility for treating the patient, and let the Saudis, the Saudi physician, they have a better knowledge to be treated, to be trained in the state.
What do you think about the globalization of healthcare? The fact that we see all around the world, borders being broken down, mm-hmm. and healthcare growing, and are there many other countries that the Saudi Arabian government also sends patients to?
Yeah, we're sending patients to Britain and to Germany. Most of the highly medical countries that they have good treatment, the same as Sweden and Switzerland. If we're going to count how many medical attache they have Saudi Arabia, we have one in Britain and the other one in Germany, and the attache in Germany, he covers most of Europe. Besides that, we have an office for recruitment in Philippines and another office for recruitment in India, which is usually to recruit physician and nursing, and also some of the technicians.
Well, thank you very much for your time.
Thank you for having me. Thank you.
Thank you.